Hello everyone, my name is Patrick McGuire. In today's demonstration, I'll be showing you how to auscultate a heart rate, an essential skill for assessing a person's cardiovascular health. Our psychomotor learning objective for this demonstration is the learner will be able to accurately measure a person's heart rate by listening with a stethoscope over the heart. I'll walk you through the steps while demonstrating on myself. Let's get started. Before we begin, let's take a closer look at the parts of the stethoscope to make sure we're familiar with it. A stethoscope has several components, each serving a specific function, and I'll explain each one now. First, we have the earpiece. The small parts that fit into your ear, they should be positioned at an angle forward, slightly forward, to create a comfortable, snug fit. The earpiece helps channel the sound from the diaphragm or the bell into your ears. Next, we have the tubing, which connects the earpieces to the bell or the diaphragm. Now, the tubing transmits the sound from the diaphragm or the bell up to your ears. Most stethoscopes have a flexible tubing that allows you to move easily when listening to heart or lungs. Now, at the end of the tubing, we have the chest piece, which is where the sound comes from. The diaphragm, the larger flat circular side, it's the most commonly used part for listening to heartbeats, lung sounds, and bowel sounds. It picks up high frequency sounds. To use the diaphragm, you place it firmly against the skin and it picks up vibrations in the body, which transmits it through the tubing up to the earpiece. On the other side, we have the bell. The bell is a smaller side that has a concave shape. It's used for listening to lower frequency sounds, such as heart murmurs and certain lung sounds. When using the bell, you want to use light pressure on the skin. If you push too hard, it might turn into a diaphragm, and making a diaphragm-like sounds, which you don't want when you're listening to lower frequency sounds. Again, so to summarize, you've got the earpieces, tubing, and the diaphragm, or the bell. So, to get started with listening to lung sounds, make sure you have your stethoscope, which you also want to make sure it's in pretty good working condition. The diaphragm, again, the flat circular part, is typically used when listening to the heart and lungs. Ensure that the earpieces are properly positioned in your ears. Again, you want to position them slightly forward, making sure you can hear clearly. Now, let's talk about positioning of the patient that you are examining. It's important that the patient is seated, lying comfortably at rest in a quiet environment. This will help ensure an accurate rate reading. You will ask the person to sit down or lay down and relax. It's best to take a measurement when they are at rest, as physical activity can cause a heart rate to increase. Now I'm going to position the stethoscope to listen to the heart. The ideal place to listen to this area is just to the left of the sternum, about the 4th or 5th intercostal space, just below the nipple line. Now, make sure that the diaphragm of the stethoscope is gently placed but firm against the chest. You don't need to push too hard, but you do want to make sure there's enough contact to hear the heart sound clearly. If you don't hear anything at first, adjust slightly. Move your stethoscope a little to find the right spot. Now, the lub represents the first heart sound caused by closing of the mitral and tricuspid valve, and the dub represents the second heart sound caused by closing of the aortic and pulmonary valves. Now, with the stethoscope in place, we are going to listen for the heart rate. As you listen, you'll count the number of lub-dub sounds you hear. Each lub-dub represents one complete cardiac cycle. To get an accurate heart rate, I recommend counting for 30 seconds, then multiplying that number by 2 to calculate the number of beats per minute. This is a quick and effective way to assess the heart rate, especially in a clinical setting. So if you count for 30 seconds and you counted, let's say 38 heartbeats, now you'll multiply that by 2 and you'll get the rate for 1 full minute. So 38 times 2 equals 76. This means that the person's heart rate is 76 beats per minute, which is within normal range for an adult at rest. Remember, normal resting rate for an adult is usually between 60 and 100 beats per minute. If the heart rate is above or below that range, it may indicate a health issue, and further assessment may be needed. Sometimes you hear the heart rate, and it may not be regular. You might hear an irregular heart rhythm or extra beat. In cases like this, it's important to listen for the full minute rather than just the 30 seconds, so you can accurately assess a heart rate. If you notice an irregular rhythm, it's important to document it, and if necessary, refer to the person to a healthcare professional for further evaluation. In a clinical practice, it's always best to listen for a full minute to detect any irregularities. And that's it. You've just learned how to auscultate a heart rate. Here are a final few tips. Always make sure that the person is calm and at rest. Listen carefully for the lub-dub sounds and count them accurately. If the rhythm is irregular, then listen for a full minute. Practice your technique regularly to improve your skills. And that's it. Thanks again.